Hi everyone, welcome to Perfect Smiles with me, Dr. Sarah Sadek, aka Dr. Gumgums. Today's video is a common question that I get asked by my subscribers, so I've produced a detailed video explaining this topic. It's all about rubber bands, sometimes known as elastics. These can be used during brace treatment, for fixed braces, or even with Invisalign. But for the purpose of this video, I'll be demonstrating how it's used for fixed braces. A quick reminder, if you're new to this channel or if you follow our videos but haven't yet subscribed, please do hit that subscribe button now to support us in continuing to make lots more useful and informative videos. Having braces alone is enough to have to adjust to, but sometimes your orthodontist will also give you elastics to wear as well. These elastics are different to the small elastic bands around your brackets that hold your arch wire in place, and they work by connecting your top brace to the lower brace. Not everyone will have these elastics, and they focus on fixing your bite and the alignment of your jaw. They can take some getting used to, but if you've been given them, please don't give up, as they have a very important job to do, adding extra tension to your teeth to help them move in the right position. If you run out of these elastics because you've been wearing them really well, then always contact your orthodontist for more. Do not buy them over Amazon, as I've had some patients do in the past, as they come in different strengths and sizes and could have a negative impact on your treatment if used incorrectly. So how do they work? Commonly, you'll be asked to wear these elastics on each side of your mouth. They will be hooked onto a bracket attached to your top canines and then stretched till it can be hooked onto a bracket attached to one of your bottom molars. I'm going to show you a few examples of how you wear elastics for different problems with teeth. In this example, the top teeth are ahead of the lower teeth, so this patient has an overjet. We place the elastics from the top canine to the bottom molar hook. This puts pressure on the top teeth, pulling them back, and it also pulls the lower teeth forwards, thereby correcting the bite. In this example, we can see that the lower teeth are ahead of the top teeth, so we reverse the elastic wear, placing the elastics on the lower canines and the top molar teeth, which again has the effect of pulling the lower teeth backwards and pushing the top teeth forwards slightly. Wearing these elastics does get easier with time. However, we can provide little aids to help with placing the elastics and removing them. And this is how you would use that aid. However, most people don't seem to struggle just using their fingers. Now I'm going to show you a case where the center lines of the top and bottom teeth are not meeting. So we can see that the top teeth are shifted over to one side in comparison to the lower teeth. In this case, an elastic would be placed from the top canine to the lower canine in a way that will pull the teeth into the correct position, thereby correcting the center lines. I hope you found this video useful and that it's been informative. Thank you very much for watching. Please do drop me a comment. Are you wearing elastics at the moment? Please make sure you continue to wear them, it's very important. And don't forget to subscribe and like the video, and I'll see you again soon for loads more videos all about teeth.